Why do I think that? I must work too many hours in the OR, just like the rest of you. I was asked to come today because Sandra and I were talking in her office. As you know, pandemic influenza has hit. WHO has now declared the influenza outbreak a pandemic. But I think a lot of people do not realize why. And you might look at me and go, well, why is Dr. Antoine up here? And I thought it might be a good idea to tell you a little bit about who I am, because even though I've been here now 3 years this week, a lot of people don't know a lot about me. I actually trained at the U.S. Military Medical Academy, USU, some time ago. And there we spent an entire quarter of our curriculum understanding and learning about issues that affect large populations. So whether it would be trauma or viral infections or parasitic infections or global starvation, we spent a lot of time understanding and learning and educating ourselves, and then going into the field environments and practicing. When I was in medical school, I went to Africa. I worked on the first viral studies of what we thought at the time we called Slim's disease, which has turned out to be HIV, which, as everybody here knows, is a worldwide pandemic. So I've had a tremendous opportunity to work with a lot of wonderful disease processes that are quite fascinating, but that also affect us as populations and unfortunately can cause death in a large number of people. After that, I spent a career in the U.S. Army. I did an anesthesiology residency, and I was at Walter Reed. From there, I finished up my career as an anesthesiologist and went into private practice for several years. And after that, then I ended up on the East Coast in academic medicine, and then I arrived here with you. Over the past 10 years, I've been spending my academic life lecturing around the world about disease processes that affect all of us human beings and unfortunate circumstances that we create ourselves. That area of expertise is called all hazards preparedness. For the past 3 years, I've been focusing on pandemic preparedness because it was clear to me from my life experiences and watching what happened with Slim's disease that we were going to be facing a worldwide healthcare crisis very soon because of influenza. So this topic, this lecture this morning, is about pandemic influenza. I know most of you, I know how intelligent everybody is, so this is the same lecture that I give to physicians. I am going to say it just as fast. If anybody has any questions, everybody's got my beeper. I love the topic. Please talk to me. I think it's very important. I think the nurses here in the UC environment have a tremendous amount of power, and I think it's very important to keep you guys educated because you can change things where I cannot. So that being said, my daughter and I have done a lot of writing together, so that's why you see her name up here. And she just recently is graduated, so she's no longer a candidate. It's kind of exciting to have a daughter who's now a lawyer. So what we'll be discussing today is what avian influenza is. We'll be discussing pandemic influenza and what it is, and we'll be talking about preparedness recommendations. I would say that these are more than just recommendations. They should be, say, requirements. And maybe I'll change my lecture, but I'm trying not to be so, I don't want to use scare tactics, because that's not the point. Education is the point. I think if people get a good education, they'll do the things they need to do to keep themselves and their patients safe. So influenza is an RNA virus that's subject to a high mutation rate. It has 3 distinct types. I hate standing behind a podium, so let me know if you guys want me to move back behind there. There's A, B, and C. We hear about A. That's the one we're hearing about now. And then there's subtypes within A and B. And if you talk to any of the doctors who are treating patients, or if you work in the ICU environment, you'll hear all these different numbers like H1, N1, influenza A. And I'm going to explain to you what these things are, because then you'll understand clearly why it's so important that we do something right now. So on the surface of this viral particle are hemagglutinins and neuramidases. And I love this picture because it really gives you a clear idea. You know, the neuramidases are one particle, these little purple guys, and the hemagglutinins are the pink spikes. And it really looks like, I like to liken it to a spaceship, because it's not a typical cell with a nucleus that replicates like we're all used to in our bodies, but actually it has its own mechanism to replicate. And the way the virus particle gets its name by virologists is how many of these little guys are on there and what subtype they are. So you see in the far right there, neuraminidase N1 through N9, and you see hemagglutinin H1 through H16. So that's where we get H1N1. It's really pretty simple, but no one ever really explains that. And what virologists do is they take the virus particle that we all get when we get influenza during the seasonal year, and they look to see where did it come from. Was it H1 or was it H5? And that's where you hear H5N1. So here for example, is a virus that, I can't remember what year this came out. It should say right there, 1992. And so it was a influenza A. It originated in Beijing. And then 32 is a strain number. That's for virologists. But the year is important. It was isolated in 1992. And the hemagglutinin was 3, and the neuraminidase was 2. So it's all just a way of classifying things, just like we do in the OR when we have an Ames case, and he's doing 500 levels, and he's doing front and back, and all. You know, we have our way of describing it. And that's all it is. It's not intimidating at all. It's just a classification. The influenza, all viruses, whether it's the one we have currently, the one we had last season, the one we're going to have next season, incubates in the human body 1 to 4 days, average of 2. Then the whole respiratory tract can become involved. It doesn't always, though. Some of us just get the sniffles and come to work and spread it to everybody else. Others get really sick and end up in the hospital intubated with pneumonia. And we hear that a lot. We hear that we have several patients upstairs, and we have had for some time now, who have influenza H1N1, and they have pneumonia, and they have ARDS. We just use these terms. What happens is we get a viral infection in our lungs, and then we can no longer support our lung system, and the pneumonia, the bacteria come in. It's like a little petri dish of lots of mucus, and they just grow in there, and the patient gets pneumonia. The whole respiratory tract can be involved, as I said. There's an abrupt onset of fever, chills, malaise, muscle aches. We all have experienced the muscle aches. Many of us get that after the annual influenza vaccine. And we get that because we're actually getting injected with a little bit of the virus particle, not that whole molecule I showed you, not that whole structure, excuse me, it's more than a molecule, but part of that, bits and pieces of a ruptured virus particle is what the vaccine is. And the severe symptoms usually last 3 to 7 days. Most of the time we all come back to work in a few days if we even take a day off. And the shedding, this is the most important part. The shedding of the virus actually occurs before any of us even get sick. So we don't even know we're sick. We're coming to work and spreading it to everybody. We all work in close quarters. We all work in an operating room. So we're actually the closest quarters in the whole hospital in the OR. And we're shedding around all these viruses. That's why when we see someone who gets sick, we're all like, get away from me. Because we know we all get sick when someone comes to work sick, whether it's just a cold. Large amounts of virus come out in the respiratory secretions. I love this image because this shows you, and this is from like 1920 with an old-fashioned camera, but this shows you how many particles come out of a sneeze. And when you hear the term from your infectious disease people, respiratory droplets, this is what they're talking about. These are respiratory droplets, okay? And we'll talk about droplets later in the lecture. But you can imagine if we could stop people from sneezing out into the air like that, or sneezing into their hand, which just shoots it this way, we could really cut down on the spread. So we all have to start sneezing like this. Really, though, in my opinion, we all need to start wearing masks. And Dr. Coley had us doing that for a long time. We've kind of all slacked off. But there's a reason. If you sneeze, and you sneeze into the mask, all of that spray doesn't go into the environment, which really cuts down on spread of disease. The mask is not protecting you, it's protecting everybody else. And I think if people make that clear, we'll all understand why we're wearing it. And it has nothing to do with the surgical field, by the way. And I could explain that to you at a later date. So annually in the United States of America, we have either A or B that comes around and gives us the flu. It kills about 30 to 40,000 people a year, 200,000 or more hospitalizations. Typically, that's the elderly or the very young and people with quote-unquote comorbidities. So pregnant women, somebody with asthma, a child with a congenital heart defect, that's who it affects the most. 50 million people are infected every year, though. So you can see it's not a high, horrible, virulent issue, but it is an impact. And the biggest impact is economic.